In this video, I answer a question very openly on what makes cortisone shots dangerous and why the doctors giving them are complete garbage. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a chronic pain treatment expert with over 15 years of experience, specifically for neck, shoulder, and arm pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick disclaimer on why I make these videos. I make these videos not to entertain, but specifically for anyone who has been dealing with chronic neck, shoulder, or arm pain for at least 6 months. They've tried just about every type of treatment. They've been lied to, overpromised, and underdelivered by the current medical model in hopes of getting some real answers to what is going on and get to the root cause of the problem to get some long-lasting pain relief finally. Now on to the video. All right, the question this week came from Brian on LinkedIn. Just a quick reminder, if you have any specific questions you would like me to cover on chronic neck, shoulder, arm pain, send them over my way. All the information to do that is in the show notes or description box wherever you're consuming this video. And if I think my answer can help, I'll try my best to get a video out to you. So the question was, I've been dealing with chronic shoulder injury for the past few years that has only continued to get worse and never been properly diagnosed. So the content you share got me down the rabbit's hole of all your videos. One that really stood out to me was a take you had that not only are cortisone shots dangerous, the doctor giving them is complete garbage. I like your direct and blunt approach to things. I've had my fair share of cortisone shots over the years to help fix the problem, which only hurt like hell and helped me feel better for a few days, but none of the doctors ever told me that it could make the problem worse. If that's the case, why would they ever offer this as a treatment? Thanks for the question, Brian, and I'm glad that my blunt and direct approach resonated with you. I understand I'm not for everybody, but I try my best just to get some information out there and be a blunt truth teller about what's going on so you as the client or the patient can continue to not get screwed over by the medical system. So what am I going to cover in the video? First, what do cortisone shots even do? And what conditions are they prescribed for? Why they're dangerous? Why any doctor offering them is complete garbage? Yes, complete garbage. And lastly, what to do instead of getting one. So first off, what do cortisone shots even do and what conditions are they prescribed for? First is they are prescribed for anyone that has inflammation, specifically in what I call a musculoskeletal injury. Their mechanism behind them is they get rid of inflammation. They also do help to temporarily reduce the pain. And a lot of times they're prescribed for inflammation injuries or pain presentations and all of what I call the itis injuries. So tendonitis, bursitis, anything time you hear itis in there, it usually means that there is some type of inflammatory process going on and inflammation is in there. So their thing is like, let's get rid of the inflammation because that's the problem. And that's not always the case. So why are they so dangerous? First is they get rid of the symptoms. Like they really do help you feel better, but it doesn't improve the function. And I always say any treatment that only improves symptoms but doesn't improve function is actually really dangerous. I say the pain in your body is like the equivalent of like your check engine light came on in your car, and getting a cortisone shot is like you just pulled the check engine light, but you didn't fix anything. So problems will continue to get worse, but you're just not noticing it as much. That pain is like built in as your body through evolution and a mechanism to like let you know, hey, something isn't right. When you put your hand on the stove, you take it off. But what's happening when you get the cortisone shot is you don't notice it burning as much on the stove, or you don't notice that the pain's there. And then the problem gets a lot worse. So just because you're feeling better doesn't always mean that things are improving. Next is it just adds more damage to the supporting structure. So the bone, the cartilage, the discs, and the tendons, they're kind of like what support everything. The muscles help you move. What happens over time is the cortisone is actually shown in research and studies is it actually breaks down the bone more, breaks the cartilage down more, breaks the disc and the tendons down more. So you have a bigger problem down the road. And I call this stuff called degeneration. It's just basically where things kind of, wear out before their time. And these ends up being the things you see on an MRI when you go to an orthopedic doctor, like, oh, you got a you got a bone spur, or you got a cartilage tear, you got a disc, you got a tendon problem. There's a lot of issues in there, but a lot of times these cortisone shots will actually make that worse. First off, because you didn't know the pain was there, so you didn't know to get off of that bad tissue, but then it continues, the force has to go somewhere, so it goes to the bone, cartilage, and discs. Next is it's just a crapshoot by the doctor. They just randomly inject in an area and say, hey, hopefully we get it at the right place. It's kind of like playing darts blind. You don't really know what's going. Hey, it hurts there in the area. Let's shove a big needle in there and pump it full of cortisone and, hope and pray and see what happens, and what they say, you can wish in one hand and you can, do something in the other hand and see what fills up first. That's what's happening with these cortisone shots. So why any medical doctor offering them is complete garbage? First off, as I said on the last slide, the research is clearly definitive about what damage it does to those surrounding structures. Like, it's one of those things where, it does get rid of the inflammation, but by the way, it's going to damage your joints and your cartilage and your disc. Like, why would we prescribe anything like this? Why would this be considered a treatment? Treatments need to be safe and effective, and they're definitely not. But yeah, this is one of the go-to things in an orthopedic surgeon's office before they ever do a surgery. Next is they're really focused more on the effect of the dysfunction, not the cause. So a lot of times for me, when I see inflammation, I'm like, what else is going on? A lot of times there's something deeper going on, maybe a problem with the muscle or something's not functioning correctly. And that inflammation is the response as to what's going on. So much of like the medical model is trying to go after the symptoms and trying to get rid of symptoms, but we never actually improve function. And then things just get a lot worse down the road. Here's my conspiracy theory. I'm a pretty big conspiracy theory person when it comes to what's going on in the medical system and just how broken and corrupted and bad it is I really believe these doctors and these clinics and these huge hospitals and all these industries that are multi-billion-dollar industries, they know it's going to get worse down the road by injecting these cortisone shots in there. And then they're going to be able to justify a really expensive surgery, which is what they get paid more for. That's really messed up when you start thinking of that. And I think of like the sinister side of things, but that's how medicine is and how the model is. Like, doctors aren't rewarded for good results. They're getting rewarded for the procedure. So if you go to someone, you got a shoulder problem and they do surgery, they're going to want to do surgery because that's how they make their money. That's how they pay their bills. It's completely backwards. That's why these medical doctors starting with a cortisone shot are garbage. They don't care. They're just trying to get their bottom line better and make more money at the expense of you. And the problem is, a lot of times people have these surgeries, and a lot of times they didn't need the surgery in the first place, and they're a lot worse. And then there's risks from the surgeries. You could have an infection. You could have a reaction to the anesthesia. It could make you worse. You could even die from it, but they make it out so easy. Like, yeah, we'll just go in there and snip here, cut here, sew here, good to go. Why? That's not the case. Why are we in a chronic pain problem and a opioid epidemic if that was like the magical fix? It's not. So what to do instead of getting one? First, just don't get one, please. I beg you, don't get one. Start with getting a proper evaluation and a diagnosis. Not just like something where you go to the orthopedic doctor, they get an MRI, and they spend like 2 minutes with you and like, oh, move your shoulder here and do that. Oh, there you go. You got this here. I saw it on MRI. Let's give you a cortisone shot and we'll send you on your way. And then I'll also sell you some magic beans on the way out too, because, we're here for miracles. It's wrong. It's deceptive. It's just complete nonsense. Understand next. Know that anything, if you've been diagnosed with anything with an itis in it, it's the diagnosis is really a code word for they have no idea what's going on. You need to have a tissue-specific diagnosis. If you're just like, oh, I have bursitis in my shoulder. I'm like, okay, so you got inflammation, but that doesn't tell me anything. It just says, hey, inflammation's happening. We need to know why it's happening. Ask questions of the doctor. Say, hey, why is the inflammation in there in the first place? Why are we just getting rid of the inflammation? What about my tissues? What about my structure? And they're like, shut up and just get the cortisone shot. I went to wherever. Look at my diplomas on my wall. I'm the best. Like, how dare you question me? I have a white coat. Like, get the hell out of there and stay far away from those people. Next is get multiple opinions. It's amazing to me, like say your car's jacked up and you take it to a few different places and they give you different answers. You'll at least do that. But it's crazy for me where people will like jump right into these crazy treatments and crazy surgeries and never get another opinion. I remember a story I had with a family member of mine. They had a back injury. This was like 15 years ago. And we went to 3 different orthopedic doctors. One told them they needed emergency surgery right away. The other one told them they were completely fine. And the other one was like, oh, it's not even your back, it's actually your knee. 3 different opinions and 3 totally different answers. And, she could have started with that surgery right away or did something. Like, slow down. I know you're in pain. And I know they say they can just take it all away right away with some simple surgery and a magic cortisone shot. That's not the case. Next is get the true cause figured out and get it treated first. That's a lot of what we do and what we specialize in our clinic is getting to the root cause of what's going on. So much of treatment out there is focused solely on symptoms. We have to understand, why are these symptoms in there in the first place? What's causing them? And then addressing that correctly. Because if we just try to get you feeling better, but we don't fix anything, it's really dangerous. It's like turning that check engine light off, but never actually fixing the car, and then it blows up down the road. And lastly, this is so important. Don't expect to just be passive in the process and just let the provider figure it all out and do all the work for you. We live in this society where we want these instant gratifications. We want everything right away. We want it for as cheap as possible and a little amount of effort as possible. But that's not how it goes. You got to take control of your care. You have to ask questions. You have to be willing to push that doctor and do your research and know what's going on, because it's your body. Nobody's going to care about your health more than you are. And if you're just passing it off, you're like, yep, I'm just going to have this surgery and they're going to fix it, I'm not going to have to do anything. They have codes and diagnoses out there called failed surgeries and all sorts of stuff. And people get messed up all the time because you're giving your power away to somebody else and you're going to think they want the result more than you do. You have to be the main driver in it and ask questions, participate, and see it all the way through. So I got a little ranty there, but hey, that's how I am. That's how I roll. So where to go if you do want to get some help, you don't want to get a cortisone shot. Click the link in our profile to learn more about our new injury treatment process that provides long-lasting pain relief and better flexibility for chronic neck, shoulder, elbow, and wrist injuries naturally without the use of, medications, injections, or surgeries. All the information to do that is available in the description box below, and you can request a no-charge injury consultation with one of our dedicated providers trained in the peak injury treatment method and get on the path to feeling a heck of a lot better, functioning better, doing it safer, and getting real results. I appreciate you watching, and I'll see you on the next one. Bye.